Hey guys, welcome back. So today we're going to talk about children and vulnerable adults. And oh man, my transcription. Okay, sorry about that. We'll start over. Today we're going to talk about children and vulnerable adults. And by the way, we've had this problem in the past of the transcription overlaying parts of the screen, and I thought that was annoying. So now I put it all the way on top, but it's a little smaller. So if you're having trouble reading it, please let me know and I'll change it back to the way it was before. With that said, we're going to talk about children and vulnerable adults. And if you guys recall, we talked about that scenario with Amber a few weeks ago. And when I looked at this, I was like, oh, this would have been really nice to have before that conversation, because it does answer a few of the questions that came up during that. But it also, that scenario had to do with some other things that we were talking about. And we're kind of seeing, hopefully, that the same code applies in different ways to different scenarios, and that sometimes you have to add all these things together, and we just haven't gotten far enough to have all the pieces of the puzzle, but we're collecting more of it. So I think hopefully this, even though it does to me feel a little bit like after the fact, it'll help shine some light on some of those things, as well as some additional things moving forward too. So without further ado, we've talked about this before too, so I'm not going to spend a lot of time on it, but we often get stuck in this place between what we need to do the best therapeutic work and then what's required of us, and these things can be in conflict. So, for example, we know that privacy and secrecy, not secrecy per se, but like privacy and confidentiality are important because that's how people build trust, right? When we're experiencing shame or there are parts of our lives that we don't really even understand or know about, we come into therapy and say, I need a space where the shame can do what it does. It's private. It wants to keep itself contained, but it's also a way to let it out so that it doesn't have power and control over our lives, something like that, right? So we have to have privacy and confidentiality, even though what we're oftentimes working towards is helping people bring these things out of the darkness so they can heal from them, and then they don't need to be private about it anymore. It doesn't have to be confidential. Of course, there are some things that we get to keep private to us that are important and sort of, for lack of a better word, sacred to us. So that's how therapy works, right? Like we need that in kind of environment. And then there are these legal requirements to disclose to parents, to disclose to the courts, to keep people safe. We have to sort of break that important and sort of sacred bond, so to speak, in order to do our professional duties to help keep the community and the public safe too. So these things often get into conflict, and that's why we have to spend so much time on them of like, I'm required to do this, but I think this is best for the person. And so how do I navigate these two worlds? Oftentimes what this means for us is we're going to be communicating to other people, both clients and people that are our bosses, people that we work for, other professions that we work with kind of around, and then the public in general too. They don't always understand why we want to be private and why we have to let things out in the public. And it's our job to then communicate why these things are happening the way we're doing them. Okay. So this is the space that we're in for today. So let's talk about children a little bit. Children do not understand the need for privacy, and it's a socially learned concept. When kids come out of their mommies, they are building attachment really fast, and they don't really understand. I mean, they are vulnerable, but they don't necessarily know it. You know what I mean? Like if you ask kids, can you touch that hot pan? They're like, yeah, sure. Of course, they don't say it that way, but they just don't know it's dangerous, right? And they don't know that both situations and things and people can be potentially a threat to their own security and safety, right? So that's what they're learning from an early age. As they grow up and they're children, they sort of learn about other people and the nice kids and the mean kids and that kind of stuff. And then people outside of their family unit. And that's just, we sort of expand our understanding and our ability to cope with risk and danger as we grow up and develop. Okay. As adolescents, then, I'm going to get myself out of the way just for a second, take a second to read that. As adolescents, there is this acknowledgement like, yeah, the world is dangerous, but, I'm not really worried about it. I can handle that. And also, like, I want to keep things private. So, like, I'm going out, exploring the world, taking more risks. And also there's this, like, I'm putting a lot of energy into building the capacity for myself to handle things. And so there's almost this inherent conflict between children and their parents, because kids want to keep private because they think they can handle it. and yet it's not really good for us to have so much that's private, right? And so that's one of the things that developmentally adolescents are trying to figure out is how much do I keep to myself and how much can I trust the people around me to be good stewards of my wellness and well-being, something like that. Ideally, we learn that in our families, but if we don't have that, then we're learning it with our friends, and we're still trying to kind of navigate that territory. That's why with therapists, if we know that certain kids are going to give us a whole bunch of trust, and adults even too, who haven't developed or matured beyond this stage, certain people are going to give you a whole bunch of trust that probably you haven't earned yet. And other people are going to give you very little that you have to really work to earn in the process. That's why communicating, here's what this process is, understanding where they're at in their development, and then helping them understand, like, here's how I'm going to keep you private, and here's how we're going to bring this stuff out into our space together. So that's part of what makes this really tricky, right? Sometimes, I'm going to get myself out of the way again. Sometimes children tell other adults with the expectation that we'll tell parents. And what I mean by that is kids don't really understand that you're not on the same side as their parents. In other words, you're there with the intention of helping that child, that client. And most kids, I think, would assume that because you're an adult, you're an authority, just like all the other adults in their life, including their parents, that you're all there to help or protect or harm or whatever. And so they just assume whatever the role they project from others, they're kind of projecting it on you. So there is this assumption that comes with being an adult, says you're kind of in cahoots with my parents for rightly or wrongly. And we have to navigate the space of sharing with these kids. This is what we can, this is what I am going to do for you, and this is what I'm not going to do. So it helps clarify for them too. Kids may not be able to make decisions that are in their own best interest. I think that kind of goes without saying, given what I've just talked about, because they're navigating that world of like, I think I can handle this. I think adults are handling it for me. And that doesn't stop when we're just children, right? That goes through adolescence. Even when you guys are in a program like this, you're like, I think this is what teachers and professors are supposed to do, and advisors and, people that I'm paying to do a job. I think this is their job, right? So part of our job as a professor and an advisor and, person in the program is helping you understand expectations about this is what I can help you with, and this is what I expect you to do on your own. So this navigating expectations is inherently part of most of our lives, right? It's just unique and different when it comes to doing this therapeutic work because of the legal and ethical requirements that we have. So we'll get into this a little bit more too, a little bit deeper, which in just a second won't take us very long to get there. Let's talk about kids' rights. What rights do kids actually have? The answer is not really that many, even though we have these confidentiality laws. Kids are technically the property of the parents. And I thought the textbook did a pretty interesting job of going back in time and saying, kids are owned by their parents, they're property of their parents. Also, it gets a little bit more complicated when you have step parents or you have foster parents, because legal rights tend to favor biological parents. And when you really sink in, I'm not going to talk about it a lot today, but when you sink into things like child custody and which parent gets custody rights of children and that kind of stuff, there's a whole bunch of legal things that if you're going to work in that space, you're going to want to get some extra training and understanding what those mean and how it can be good that biological parents have the right to protect their children. And also there are plenty of situations where kids need to be protected from the people who brought them into the world who aren't good for them. And that's where foster care systems come in. And, there's a whole bunch to talk about there. But whether this is the best legal system to have or whether there's a better way is a discussion that is outside of the purview of this, but that affects us in our counseling work. So that's something you'll want to get a little bit more informed on. The book does a better job of digging into that too. And I don't cover it in great detail in here because not everybody's going to work with kids. And so that's just one of those ways that you could specialize a little bit and get really informed about what rights do children have, what rights do parents have, that kind of stuff. As we talked about before, though, in Wisconsin, and it's, I think, just right up here, that well, I'll hold on to this for a second. Generally, children under 18 are not adults, so that's the age. The second sub bullet point, generally in Wisconsin, the legal age of consent is 14. So in our case example with Amber, she was 13, and we were asking, there's this confidentiality stuff that that clients have, so we don't have to release records to parents if they ask, and yet she's only 13. So in Wisconsin, the age of consent is 14, so we'd have to give up those records, right? Even though it goes against or is in conflict with our therapeutic duty to protect our client, right? That's not like that everywhere. Some people advocate for 14 as an age of consent for counseling. Some people in some places and the way that people think say, well, for counseling, it's important that they make those decisions, but for other health treatment, they're going to need help with adults. Some people say for things like abortions, this is, the age should be younger or older, and people have conversations about this, which is why it's different in different legal jurisdictions, federally, states, rights, that kind of stuff. So there's that. That's why it's different, because people have different values, right? Emancipated minors can consent to counseling and health treatment. Be careful sorry, I think there's a typo here. Be careful when avoid advocating for a position. There's totally a typo in there. So emancipated means I'm no longer the property of my parents, and I'm the guardian of myself, which sometimes these words feel a little goofy to me. Like, I get legally why they use those words, but like calling people property of other people seems like not a good thing, right? And yet that's the way our legal system is. So I think what the spirit of what this comment is that sometimes I think we can get stuck between, like, even if we know a legal fact that a person has right to consent to something, sometimes we have therapeutic reason to say, but this isn't going to be good for you. It's not going to help you. And that's why it's so important to really learn and get familiar and confident with what are the legal requirements and what do I have to do versus what is optional, and how can I then have a conversation with a client that says, here are your choices. Here's what I think is going to be helpful for you, and then here's what we're legally required to do whether you like it or not, so we got to make the best of a bad situation or something like that. So the reason I say be careful when you're advocating for clients or for a position, it's one, yes, know the laws, but also again, I guess maybe this isn't the most clear way to say this, but like, if you're going to advocate for somebody and there's a risk either to their therapeutic goals or to the legality or ethicalness, what's the right word? I'm fumbling today. The ethical quality of their decision or something like that. When you're doing that, it's helping them understand the risks and benefits, right? Just like there's risks and benefits to counseling. When people get into these strange legal situations, there are risks and benefits. And so if you're working with kids, it might be helping the parents understand that. If you're working with adolescents, it might be helping them understand that too. So we've already looked at Appendix B. So just know, I think we've already said this, but you can modify those things to, if you're working with kids, you may want to get children assent, not consent, not legal consent, but assent. In other words, the kids buy into the process too, but the parent's signature is the one that legally really matters. Some people choose to do that, some people don't. Depends on the context. So, parents. Parents are a controversial and tricky topic, because some parents are wonderful because they bring their kids into counseling and say, hey, I understand a little bit about your role. I've been helped with counselors before. I'm here to let you do your job and let me know if there's something that I can do to help facilitate something going on at home or whatever. And they have this kind of hands-off approach. Some people have such a hands-off approach that they don't seem like they even care, and you'd love them to be more involved. Other people are so stinking involved that you just can't get rid of them. You know what I mean? And it's a spectrum, and people are everywhere in between. Of course, I think probably all of us know that parents can be valuable allies in the counseling process. They have the right to be. They legally have the right to be as involved, like they get to be the decision makers, right? But parents don't always know how they can be helpful or how they're being harmful. And that's one of the skills that's not specifically clinical with your client, but also saying, how am I going to communicate what's going on over here with my client to these other people who have some stake in the game, but really don't understand what it is. So that's something you can practice as you go on too, of like talking with parents of different kinds to help them understand what they can do and what they maybe shouldn't be doing that is not helpful. If you withhold information from parents, you assume the responsibility for harm caused if that information leads to future injury. Okay, so here we are again, stuck in this conflict situation. I want to do what's right for my client because therapeutically that's important, but then I'm taking on some of that responsibility if something goes wrong, right? And that's professionally kind of your duty. That's kind of what we want to take on, is that responsibility for the well-being of clients who can't do it for themselves. That's just the nature of the work. And yet, that's parents' job for their children, right? They're supposed to be taking on the risk and the harm to whatever happens to this child. If you're causing it, they need to be responsible to pull their child out and go to somewhere else, right? If they're causing it, then it becomes your thing. In other words, it's sort of this weird, murky area of shared responsibility between the parents who are supposed to care for their child and us who are supposed to care for the child, and figuring out how we're going to collaborate together to do that. If we can, that's an ideal situation. Sometimes we're working against each other. And so depending on how the relationship is, if that child is required to be with you, parents might have a more hostile approach to you. If you think the parents are not doing something they're supposed to be doing or harming their child, you might have a hostile approach towards them, right? And yet we want to stay in that place of collaboration if we can. The third bullet point here, want to respect privacy of the client, but also respect the parents' rights and responsibility. I think we've already talked about that one enough. It kind of goes without saying that it's wise to open up conversations early in the process through the informed consent process, which we've already talked about. And so I'll just leave you with this. It's good to talk about it early, but you also don't want to overwhelm clients with too much information early that they're not going to retain anyway. You want to jump into the work and start learning about how you can help. What's the actual issue here that we need to be working on? And then how can I create a treatment plan to help do something about that, right? So here again, an inherent conflict. Do you say too much or too little? Do you inform them about everything in great detail or just the highlights? And that's what we get to work. You get to practice that. Watch other people do it. You guys are asking good questions in class, and then just get out there with clients and try it and talk to your supervisors in the context with which you're working and seeing those clients later. So I think we've talked about that probably enough. And then just a last kind of final, pro tip, I call it, I guess. Practice how you'll talk to parents about clients if, or more likely when, they ask to know what is going on in sessions. That's just one of those things, like, you're going to get exposure to it. The more you can practice in advance thinking about, even just in our case scenarios, how would I have this conversation with the parent? What are the actual words that I would say? If you have to stand in front of a mirror or record yourself in front of a camera, it's awkward, it's uncomfortable, but even just sort of getting ready in that very rote kind of way can be really helpful in just easing some of the nerves and the tension of saying, like, here's why I think I want to keep this private, and here's how I'm going to explain about the well-being of the child to the parent or something like that. So something you can do later. Here's some tips about how to do that. I'll cover mostly the highlights. I'll let you sort of read this. It's a little small. Maybe I'll read most of it, I guess. I don't know. Responding to parents. Discuss it with the child and see if the minor is willing to disclose that information. Ideally, even if you're required to disclose information, you still bring your client in as part of the process. In our template that we're using to go through all these ethical scenarios, we see client involvement, and we've seen examples where we really want to involve the client and think they absolutely have to be a part of this decision making, and other situations where we said it might do more harm than good to bring that client in and talk about this, given the context. So this is one of those take with a grain of salt, but it's really helpful if you can include somebody in the process, even if they're a kid. And there's different developmental ways to do that, of course, based on how much insight they actually have and how much they're requesting to have and that kind of thing. I've heard different comments about this, and I don't want to spend too much time, but some people look at children and say, I basically look at them as like little adults. I tell them all these adult things, and that might be missing some of the nuance of what they actually can handle and what they actually need to know. And other people say, they're just children. They're so innocent. Let's not spoil them with this big adult world yet. You know what I mean? So I don't know the right answer to the right balance, because I think so much is context dependent. But maybe do some thinking about that of like, how do I look at children? Do I see them as vulnerable and needing our support and protection? Or do I see them as they're actually pretty resilient and they take in a lot more of the world than we give them credit for? And maybe that's worth a discussion in class or something. I don't know. Another tip to responding to parents, the second one here: persuade the adult that the child's best interests are not served by revealing the information. In other words, parents may want to know what's going on in session. They may want copies of records and all that kind of stuff. And so what you can practice is, how do I tell them that you have every legal right to do this, to this information, and it might not go very well in terms of our work together. So I can give it to you, but here are the pros and here are the cons. Here's the risks and benefits. And just having that conversation with them, it can feel like persuading. Some people like to use the word manipulating, and sometimes parents see it as that. But just assure people, like, I will comply and do everything legal that I'm required to do. And here's why I think it might be helpful to not go there. And if you can trust me with this, with the process that we're working through, then I will give you something later, or I will talk to you more about what's going on, but I'm going to do it in this way. Is that okay with you? That kind of stuff. It's hard to even describe this without some good examples, but if I think of some, I'll come up with them too, or I'll share them with you. Scheduling joint sessions with parent and child, that's an option to you. One thing that I've heard of a lot of different arrangements is people have different styles of like, I'm going to bring the whole family. Like, let's say a mom comes in with teenage daughter to get counseling for the daughter. Some people have the parent come in together right away with the child. Some people say, well, let me talk to the daughter and then I'll talk with mom separately. And some people see the mom first. And like, it really is kind of personal preference of how you're going to facilitate that and how much involvement parents have in these different situations. For me personally, I tend to say, let's bring everybody in together and then have this communal conversation about roles and responsibilities. And as things change, I like to let people know, like, I'll bring this stuff up as we go. You don't have to make decisions. You can have opinions, but you're not required to make decisions about how the therapeutic process works. I'll communicate that to you and ensure that we're all okay with this and explain why I'm making those decisions in the future. So usually it's bring everybody together and then ask for time separately with different people. And depending on the context, sometimes it's parents first, sometimes it's kids first. Sometimes we do the whole session together, especially if it's really young kids. And I just want to see the interactions with parents, that kind of thing too. So inform the child ahead of time and then disclose the content of the session to the inquiring adult. In other words, this is very much like our example that we used. We have Amber. If parents say, well, I want a copy of the records, and you're like, okay, I can get them to you right now. Here you go. It can be helpful as much as possible to say, well, do you mind if I have a conversation with Amber about this first before I release them to you? And I really want to do that. And that's important that we follow these rules. But is it okay if I have that conversation first? You're not required to, or you don't have the ability to really withhold, but you do have a reasonable. You don't have to do things on other people's timelines or to their demands. So it is okay, even if you're not saying, well, I want to have a conversation with her first. You can't really do that legally, but you can say, well, and this is something maybe you put in your informed consent document. Most people don't have this because it doesn't come up that often. Excuse me. But some people will say things like, with documentation requests, I reserve the right to have 48 hours to put those documents together, et cetera, et cetera. So if that's helpful to you, go ahead and do it. If not, don't worry about it. But this will come up later in the slides too, but just know that you have the right to say, I will give you these things, but you have to give me time, and here's how much time I need to do that. So you have every right to say that. Refuse to disclose the information to the inquiring adult. Now, this is where it gets a little tricky, because there are some times when you can do certain things, but I think what I'll leave you with is just ask for help. Ask for a supervisor. if you're in your own practice, call your attorney and say, what am I legally required to do in this context of this situation? You can refuse some things, at least temporarily. Some things you can't, some things you can permanently. This is where it gets tricky. So just know that's it's an option to you, but you'll need to learn more once you get on site working with your clients about how they do handle those things. That's especially true if you're working for an agency that has their own agency policies, if you're working under a supervisor who takes on the legal responsibility for your work. So for the first long while you're learning this, you don't have to worry about that too much. You shouldn't have to worry. You can learn about it, but it's technically not your job to be responsible for those things. You can ask and people should help you. That's how it's supposed to work. Non-custodial parent rights. So we're talking about people who don't have custody of children, but like a grandmother of who's dropping the child off to appointments or something like that. There's all kinds of scenarios where, people get dropped off by their caseworker. Sometimes people get dropped off by an uncle. It's all kinds of situations. Related to this, counselors refuse to support one parent over the other in a custody controversy. In other words, we talked about this in our Amber example too, but it's taking sides just doesn't work. Even if sometimes it feels like one parent is being good and healthy and the other parent is being irresponsible, and we have this tendency to want to help protect that mother and this child or that father and this child against the bad behavior of the other one. But even still, our role is to be supportive of the family unit, because what happens is later on down the line, well, there's so many outcomes here, but I'll give you one example. Sometimes it's really important that you help support that child in being protected by that one parent who's doing healthy things, and that's a good thing, right? But what can happen too is that child grows up and says, well, I never really got to talk to my dad because that person, he was sort of excommunicated by my mom, and my therapist helped sort of facilitate that, right? And so then the other conflicts can come about later on, even if we're thinking we're doing the right thing. That's just a kind of extreme example, and so probably not the best one. But in the one we talked about in class, where both parents have custody, until somebody doesn't have custody, you still don't need to villainize them and turn them into the enemy. You can say, I can't give them records, but that doesn't mean they're necessarily the bad guy, right? And so it can really be helpful to take a neutral stance. This is therapeutically controversial because some of us believe that people, and I'm really going to try and summarize this in a way that's captures the big picture here. Some of us believe the world is a dangerous place and we need to be protected from other things, and we need an advocate and an ally to go into that process and say, yep, the world is dangerous. Those big bad men and women are doing bad things, or that government system or this social program or whatever, it's just hostile outside here. And so we need to work to fight against that system for equality and equity and fairness and all that kind of stuff. Other people think that the system is that way because humans created it and we have to work within that, and that it's not, people are generally good. We just have to learn how to access the good parts of them and that kind of stuff. So it's really this big philosophical question that you have to ask yourself of how much do I get to be an advocate and an ally, and how much do I not do that? So in other words, per this bullet point here, do I take sides with my client, or do I not do that because it's not helpful or appropriate? And this kind of feeds into a much bigger conversation and your own theoretical orientation to how you think client change happens and what their needs are at the time. So that's a whole conversation we can talk about in class if you want to. Another thing, this is kind of switching gears quite a bit, but this idea that child custody evaluators, if you're ever in a situation where you have to give advice to a judge about the fitness of a parent to parent that child, you are in a different role than your counselor. All of a sudden, you don't have a client per se, but you are in the role of somebody who is an outside, completely objective, non-biased observer of what this person's needs are. And that is a very, very different role, and sometimes overlaps. Like if we have a client, we've done an evaluation with them, we're then asked to turn into an evaluator. And that's just a different thing. And so again, I feel like I'm going to breeze over this too much because there's so much that I want to share about this because I think it's important, but I don't want to get too far into the weeds here. So bring this up if it's a question for you. But as evaluators, our job is to be non-biased. As therapists, our job is to be very biased. We want the best for that person. We want that client to be well, and we're on their side, and we share this empathetic experience together, hopefully, because that's how therapy works. And yet, to help move the system, and there's an important part of advocacy and protecting people legally from the hostility of the world, right? That's a part of our work somehow. As that person, we have to do and make decisions that are different than our therapeutic decisions. So, in most of those cases, our job is to be non-biased. But if we have a client first who is a child, our duty is to that child. As an advocate, an evaluator, our duty is to the courts and to help them make good, legal, sound decisions based on the well-being of the child in question or something like that. It's a little bit confusing, but if you think about it, which hat am I wearing at a time? Am I now my therapist or am I now an evaluator? And who am I trying to help? Am I helping the courts? Am I helping the people? Important roles both ways, because we need courts to make hard decisions that we don't have the power to do as therapists. But we also want people to be well. So that's something you'll have to navigate as you go through your future work. But one thing I will say too, because I've heard students show concern about like, oh my gosh, this is freaking me out, all these legal requirements. Some of you choose to get into these situations based on your work. Like if you're working for, court-appointed clients, working with court-appointed clients, if you're working in a substance abuse or legally adjacent, like correctional facility or something like that, you're probably going to have more of this in your life. Others of you who are just treating depression, anxiety, eating disorders, I don't know, whatever else, in like an outpatient setting, you're probably not going to have as much interaction with this kind of stuff. So it's maybe less relevant to you. Still need to be aware of it, but less of your day-to-day work, so to speak. Okay, school counselors. Schools are a whole different beast that I frankly don't have as much experience in. I think you guys know that already. And the culture is just very different too. So the way risk reporting works in schools, we still have all the same requirements as counselors, but the schools have just a different system. So I'll try and do my best to speak to the unique culture of the school, but there's a lot that you'll pick up on from your other professors and from school experiences. There's a wasp flying over my head right now. We have a bunch of them in our building. They get in sometimes, and when I'm recording this, it's cold, so they come in and they're all slow and just probably freezing. I think it needs a hug. I'm not going to try it. They'll get stung. You may need to report risk behavior to administrators, but not necessarily all risk, right? So here it goes back to that conversation about what is imminent risk to self or others, and what does the school and school culture. There are different requirements too, not just this clinical, therapeutic, mental health kind of requirement, the stuff that we talk about, like the Tarasoff decision and all that kind of stuff. But sometimes schools have unique requirements about what's reportable and what isn't. So that's where it's going to take kind of learning about your school. What are your counselor duties? And then what are school policies or state policies even on what needs to be disclosed and reported? And sometimes those can come into conflict as well. And so that's why there's just more to learn there that I can't teach you in this class. The question of what is imminent and what constitutes risk that's reportable. To the second point here, how much do we report? That depends. That's a good question. That's why I'm being a little bit cagey about this, because when you decide that it's your duty to breach confidentiality is something that we've navigated, that ambiguous gray space. And then how much information that you give to people outside of that is also another one of those questions of like, it depends. So I'm going to leave that one open for now. More discussion can be had later, but we almost need like a case scenario or something. So maybe I'll include that as a class activity next week. Parental demands may breach confidentiality. So in other words, school counselors are not expressly required to request permissions from parents because they should know that counseling is an optional obligatory service. In other words, if you're a school counselor, do you have to require that parents know that their child is receiving these services? This the last bullet point here, I'll get out of the way so you can see it. That depends. It's not an ethical or legal requirement that I know of to require that parents give permission for counseling to happen with their student. As I say that, I'm a little timid because I'm like, I don't really fully feel confident in my understanding of what happens in schools well enough to say, you don't have to let them know. Part of the reason is because I hear people saying to this last bullet point of like, it's the right thing to do. And I don't know if it's legally required to inform parents, but I don't think it is. But it's probably the right thing to do. And yet, I don't know. You know what I mean? There are some situations where you're like, well, parents are abusive and this child is suicidal, and I know that the kid's going to go home and the parents are going to give him heck for it. But do I do that, or do I protect the child even though there's risk here, right? And so these are the hard, difficult decisions you have to make about what am I legally required to do, which, you know, if you're not required by ethics or law to inform parents about what's going on, then do you do that? Or is it just the thing that's probably going to be the most helpful? These are the tough situations, okay? By the way, when I'm talking about what is not required by professional ethics or law, disclosing what's going on in sessions is different than a request for documentation like we were talking about earlier. In other words, or just another example is disclosing this child is even receiving counseling or counseling support, and whether you get parents' permission to even start that, like at the informed consent process. That is the questionable thing we're talking about here. So a lot of nuance. I feel like this part is getting a little bit more confusing. Let me try and break that down, see if I can be as clear as mud. There's a different kind of informed consent process for children at schools because there are different ways in which the school will inform or request that parents are okay with this. In other words, when I was, my son is 8, and so his school sent home this document at the beginning of the year that said, kind of like those consent to use your photo for anything we want to, sign off kind of things. It's sort of one of those of like this blanket thing that just so you know, we have school counselors and they're going to do their work. If you're not okay with that, let us know. Otherwise, by default, we're going to say it's a good thing to have these school counselors around. That's what we're really talking about here. Not do I withhold records and what do I do with parent requests for information about their client, the student's care or something like that. So parents have every right to be involved, but how they get involved in these processes oftentimes have administrative policies or processes that kind of assume that it's going to happen and they'll be okay with it. So more to be said there, but we can talk about it in class later. So this, when do you disclose information? This goes back again to what we're talking about before, is if there's abuse, if there's compelling evidence that there is abuse going on somewhere. It doesn't have to be just at home. It could be at the school. It could be, in school, out school, whatever. If there's abuse, then you disclose, right? And that's when you call the appropriate person to discuss what that is. That appropriate person could be school administrators, it could be parents, it could be child protective services, it could just be the non-emergency 911 line, it could be the emergency 911 line. It really depends on the needs of the situation. If the risk behavior is of such an intensity, frequency, and duration warranting a confidentiality breach, of course, that's kind of a blanket statement that we've been talking about here. Considering age as a factor in dependency and the need to protect. In other words, young kids who need more of us to be involved in making sure they're getting the protection they need might need you to step in sooner. As kids grow, they have a little bit more agency to self-advocate or to be empowered to do things on their own. And so that's where your understanding of developmental age appropriateness is really important here. Let me give you kind of a quick little kind of example of that. If somebody's experiencing abuse at home, younger children will need you to step in and take care of that process. older kids, if they're say like 16, 17, 18, 16 or 17, they might be able to, make decisions for themselves based on their own best interest that you may not necessarily have to report out on. In other words, we don't have to quite be the protectors when people can protect themselves, when they have the ability to do that. Age appropriate ability, of course. So, and then address proactively about confidentiality and its limits. We've already talked about that. And that just takes practice, really. Let's talk a little bit about school counseling and dual duties. This is true of the rehab counseling world too. And even in clinical mental health counseling, we talk about dual relationships, and yet there's more of a threat in these other places because there are these other parts of our school and rehab kind of work that we do that's sort of like, it doesn't feel the same as clinical mental health counseling. And it's not this like, using our psychoanalysis skills or something like that. It's things like doing college field trips and job readiness and writing interviews and doing case management kind of stuff, which is appropriate for us, making phone calls to help connect people with community service and that kind of stuff. As we do those kind of things, it changes the nature of the relationship we have with clients, right? So having a good, clear understanding with yourself about your role and then discussing those duties with other administrators, like, I can't do that because as a counselor, I can't give that kind of information to people outside of the counseling context. But I can help set up their classes for next year based on how I know they interact with other people or something. But these are different things, and knowing our boundaries is really important to help other people understand them, which we've said before. So it just definitely changes. Other school counselors will have better examples of how that really gets tricky, like as being hall monitor. You can imagine a scenario where there's like a kid that you've seen and you really feel like, oh, they're vulnerable and we've had these great sessions together, and they come up and give you a hug in the hallway and you're like, okay, but I can't really disclose that they're a client to all the other kids because kids can be weird about stuff, So how you then care for people in a public setting versus the private setting really puts you in a strange place. Some people will kind of get cold, so to speak, and say like, okay, I can't do hugs outside of whatever, or I'm not going to acknowledge that you were a client or whatever. And other people say, no, everybody's a client. I want everybody to feel the warmth and love that I have to project and that kind of stuff. So that's a personal thing that you get to figure out for yourselves. As a consultant to other teachers, I'm sure school counselors can tell you well more than I can about another, you're in a faculty lounge and people are griping about some kid in their class and they're just sort of venting because they have their own stress to give off, or maybe they're just being crotchety old weirdos and, doing things that are not helpful at all for those kids. But so whether it's like appropriate venting or just, I don't know, being negative or however you want to say that, sometimes people will go to school counselors and it'll start to feel like you're more of a counselor to the staff than you are to the kids. Is that appropriate? Depends on how you look at your work. But talking about kids and basically triangulating the counselor into a relationship with those kids is kind of what's going on sometimes. So it's one thing to consult with other teachers to help do things that really facilitate learning and growth and mental wellness to the kids in classes. It's another thing to bring that person into the treatment with you. That's a really delicate place to be. So, yeah, I'll just leave that there. Reporting abuse. The first bullet point, many counselors don't report in order to maintain confidentiality. Yes, that's probably true. And that's that conversation of how much do you think that person can handle, and at what point are they not able to maintain what's in their own best interest? And at what point are we protecting ourselves from potential liability, right? It's a difficult question that we've talked about enough that I'm not going to go into it here, but worth conversation because we need to have it at some point. Counselors are more likely to suspect defensive parents rather than cooperative ones. Just a bias. I think I pulled that out of the textbook. Be interested to hear what you guys have to say about that. Whether you think, I don't want to call it like parental blaming, but there is something about the responsibility for parents to create positive attachments in their kids' lives, and how much we sabotage that based on the own pain that we live in as parents and that we're carrying over from our parents, right? Our own experiences or whatever. So there's this tendency to want to believe that parents are responsible for their kids' stuff. And I can tell you this as a parent, we desperately want to help our kids and don't want to be the cause of that. And so when it comes to reporting abuse, we want to protect ourselves and stay out of trouble and, believe we know what's in the best interest of our kids. And sometimes we don't, right? Because we're dealing with our own stuff. And so just know that if you have that bias, one thing I think we've talked about in class just very briefly, but you should consider is how am I villainizing anybody else? I think I've said this, but there's a book called Crucial Conversations, and I highly recommend it to you. It's more of one of those like business leadership kind of books, but it's about having difficult conversations with other people. And one of the things that comes out of that is that if you're telling stories that victimize somebody or villainize somebody, you're probably not open to being empathetic and compassionate towards all people in the situation, right? Sometimes there are victims, sometimes there are villains, but even if we look at that through that lens, and that is the reality, it shuts us off from being able to help others in the process or being kind of like able to facilitate as much growth as we possibly could. It goes back to that conversation of, do we see the world as hostile and we have to fight with our clients against it? Or do we see the world as dealing with its own pain and we are there to help cooperate and be diplomatic about, helping people all get their needs met, not just this one client? It's an open discussion. But just know that's one of the biases. Sometimes we are reluctant to report because we want to avoid betraying trust, which I think we've discussed enough. We fear that CPS or any other social program, police included, will handle things poorly, which, no surprise, sometimes they do. And yet, we have these legal requirements that we have to report to those agencies. This is where we can, this is worth a good conversation too. There's a lot of good conversations coming up today. But we should look into ourselves and say, how much do I trust the people around me and the practitioners? And what is my role in protecting people from dysfunction? In other words, if I have to call CPS and I know CPS is well-intended, but sometimes burned out and sometimes overwhelmed, and depending on where you're at and who you're working around, they can get a little twitchy with the trigger in terms of pulling kids out of their homes. And if we think, yeah, this person is an addict and they're on drugs, but grandma's really doing a lot of the caretaking, and we call because there's drugs in the home and there shouldn't be, we call CPS and we have to make that report of abuse, that child loses their grandmother in the process. And so their primary caretaker too, so those are the kind of things that we're like, how do we handle this? What's legal and what's the best for the child? Therein lies an ethical conflict. Fear of retaliation for the perpetrator, good example. Not going to say much more about that one. And then hope of maintaining a relationship with the family so adults can be helped to learn better parenting skills. In other words, sometimes I'll avoid helping the child client that I have because I think the parents are learning something in the process and I want them to be able to help the child differently. So I'm like kind of treating the parents, what's the right word, at the same time, or by, I'm blanking on the word, but vicariously through the child's work, I'm really helping the parents, that kind of thing. So I don't want to make parents upset, so I don't make this report of abuse, whatever. So hopefully you get the point. Okay. When we are reporting abuse, we must have evidence. In other words, it's one thing to say, well, the client told me so. It's another thing to have documented evidence in your clinical notes. That's why reporting can be so important, or documenting can be so important. You have to show that there is a legitimate risk worth breaching confidentiality, and it has to be in writing too. That's an important thing. Follow procedures of your employment setting, informing your supervisor. Hopefully these are all pretty self-explanatory, and you'll get practice doing that when you get out into the work. We've already mentioned this fourth point, but others may want information that you are still ethically required to keep confidential. So as you start reporting out, people may ask questions, and you might have to say, I can tell you this, but I can't tell you that, something like that. In some places, you can report anonymously. In other words, if you need to call the police department and say, I'm not going to say who I am, but here's this child, here's the situation. In most cases, and I don't want to say all, because there's always some exception to the rule. But in most cases, my recommendation to people is be bold and stand behind your claims. In other words, if you see something, say something and speak up and do it with your own voice. I know that's hard, and I'm not even the best at doing that in lots of situations, right? Well, not right. You don't know that, but I am really bad at that. And in some situations where I probably should be doing more to advocate for a certain issue or person or something like that. That's a separate thing a little bit from if you do have to do that advocacy, be confident and stand strong. Put on your best Superman pose and say, there's a problem here, and I'm going to put my name on this and stake my professional career on this being the right thing to do, something like that. So take it for what it's worth. In some cases, reporting is enough. In other words, I called, I made that report. Now I'm letting CPS or the police or somebody step in. In other cases, there's going to be more parts to the process that you'll be involved in. In other words, like follow-up investigations or providing documentation or something like that. So just know that that's a question that I hear from time to time from people of like, how do you make a referral? Is it just saying, hey, you should go see Dr. Smith over across town? That's a referral. It also means sometimes calling Dr. Smith's office and getting a release of information signed so that you can send over records to them. And like that's can be part of a referral too. Similar here, when you're reporting things like abuse, sometimes it's just making the call and hands off, let them take care of it. Other times it's, is there anything you need from me that I can help to facilitate this process happening? And it might be more. So just be aware of that. If somebody is requesting information from you, this goes back to that point I made earlier about just because somebody asks for records, just because somebody wants information doesn't mean you need to immediately bend over backwards and give it to them. It can be very, very helpful to communicate a timeline, even if you don't want to do it. Say like, I need a week, I need 24 hours, I need 48 hours. My schedule is packed, but if you could give me 3 days to get this to you, I will get it to you by Friday or something like that. You get to set some boundaries to advocate for yourself too, especially in places where you are dealing with angry parents or pushy attorneys or something like that. So just know that you have the right to have your own sense of wellness and expectations about what you want from other people too. Some of us are such helpers and we just want things to go well and we don't want anybody to be angry with us. And we are so nervous about standing up for ourselves that we just want to comply with other people's demands. And what I'm telling you now is that that's who you are. That's who you are. But really do some work to practice saying, nope, I will get this to you by this day. I have the ability to protect my own wellness and my own schedule, and I need some time. You need to give me some time for that. That's okay to do that. Here, I'll say it again. That's worth a conversation. By the way, that's the kind of feedback that I like giving you guys. The more that I don't look at you as just learners of the content and I see the individual parts of you and I can say, well, I see that you're learning about reporting abuse, but I also see how that is hard for you individually. And this is what I think might be useful for you to really practice that. I love when I get to know you guys well enough so that I can give you that individualized feedback of how does this matter to you specifically. And I don't always get there, especially not with everybody, but the more that you can reveal yourselves to me and we get to learn about each other, the more we learn in the context of it's really going to matter to us later in our careers. Okay, more reporting or abuse. What if my school requires I disclose potential violence like gun crimes, but I don't assess the person as high risk? In other words, the school has a policy that I have to break confidentiality if any mention of a gun happens. And you can probably imagine why, pun intended, people are a little trigger happy with making these warnings, right? But if somebody says something about a gun and I'm required to report that, but it's not necessarily a person that's high risk, that puts us in this weird situation of like, I don't think they're going to be a danger, but I have this thing that says I have to do it if those words come out of a person's mouth, right? That puts you in a weird situation that go back to these things. Where was it? I don't know where it was, but go back to the recommendations for how do you have that conversation with your client about here's what I'm required to do and here's what I'm going to do. but here's how we can navigate through that. Okay. So you can be supportive of your client, even if this is something you have to do for them and hold them accountable for, or preemptively set them up to say like, hey, if this is potentially going to be a thing, here's how we're going to deal with this, that kind of stuff. I have never had to make a report about somebody having a gun or being dangerous with a gun, other than like, suicidal things, but that's a little different than reporting in a school. I can tell you one thing though that can be helpful in those situations is if you think somebody is at risk and has the means and intent of either suicidal ideation or homicidal ideation or just danger to themselves or others, talking about that stuff up front and saying like, look, I know you have ropes. I know you're feeling like using them. I understand that. And if we get in this situation, I don't want to have to call these other people who don't get you, they don't understand you, and they're just going to throw you in an inpatient unit because they think that's the best solution for you. You and I have talked. We have a safety plan. I understand these things. So if you're ever getting in this situation where you think you're going to use that sort of weapon thing on yourself or somebody else, before we use that word that's going to trigger off this response, let's see if we can talk about that in a way that can diffuse this before it gets too bad. Usually people respond to that kind of thing well. And in other words, we're not saying, let's make this word taboo and never say it so that I don't have to be responsible to deal with it. It's, I want to help you in your process with understanding the limitations that I have as a professional so that you get what you need to be as well as you can be, right? And sometimes that is, let's call in other people, but let's do that together, Okay, here's a list. Counselors can be advocates for children with HIV, children whose parents are in prison, children grossly overweight, children who have experienced family hardships like suicide, et cetera, et cetera, et cetera. There's all kinds of different reasons why we could be that advocate for a person. In other words, what is abuse? This list is too short. There's a million different things. The question is, what constitutes imminent risk? Do these things on this list constitute imminent risk to the child? Of course, we can be advocates, but whether that requires a breach of confidentiality is in question, right? The last piece is more of just like a self-reflective piece. Know your perspective on drug and alcohol use, whether you think it's like the worst thing in the world or whether you think, yeah, people do it, but it's not going to kill them. Premarital sex, abortion, appropriate discipline, how, whether spanking is okay or whether punishment is an appropriate response to behavior or whether it's positive or negative reinforcement, that kind of stuff. Be aware of community standards and culture, that kind of thing. I'm just checking the time here. I know we are at almost an hour and I'm talking too much, so I'm going to speed up here. Now we're talking not about kids, but about vulnerable adults. Here's a quote from the book. Adult clients who've been legally adjudicated mentally incompetent or who have legal guardianship appointed based on their diminished capacity. That's a definition of a vulnerable adult. In other words, you are of this biological age, but emotionally or cognitively, you don't have the mental competence to make legal decisions for yourself. That's the idea here. There's a lot of abuse that can happen and has happened with not only vulnerable adults, disabled adults, but also elders. Elders are vulnerable in their own unique way, even if they still are legally competent to make decisions for themselves. Sometimes they're not physically able, or just have the capacity. Like if you get put in a home, like a full-time nursing care facility, because physically your body is breaking down due to age, but you're mentally aware. Even then, I might be mentally aware that there's a problem, but not physically able to do anything about it because my children have put me here and the legal system says it's okay. I have no recourse, right? So these things can happen there because people get stuck in situations for which they have no power. Vulnerability. Isn't that what vulnerability is? It's not only abuse that happens to them, but deprivation or neglect, in other words, of not getting things they should have in order to thrive. Two different kinds of trauma, right? So deprivation of medications, deprivation of medical care, deprivation of shelter, food, therapeutic services, other physical assistance, etc. This is one of the big complaints I hear about facilities and people that put their parents in them. It's like they just didn't get the care they needed. They gave them the wrong meds. They weren't feeding them. They didn't give them like any attention. They hardly any windows to look outside, like all that kind of stuff. It's just not an environment to thrive, and it wasn't good enough. And that can be true. How much of that is imminent risk, and how much do we have to report on? Part of our question. And then lastly, not every state requires reporting such abuse, but Wisconsin does. So you have a legal obligation, and we'll save what that actually looks like until class, and we actually look up the statutes and the codes and that kind of thing. I'm going to breeze through this really quickly. What about confidentiality when a client is in cognitive decline? In other words, at what point is somebody's cognitive capacity such that they can't make decisions anymore? This is where attorneys often get involved and family members get involved about things like legal guardianship and change. I don't really see a lot of people working specifically with elder population who are going through that, but I hear more of people whose parents are going through that and they're struggling with, how do I then manage this? So whether you're in either situation, that's kind of something you might get to navigate. Power of attorney and advanced care directives. Counselors are not typically really well informed with like these kind of legal documentation things. Power of attorney is basically, do I have power to make decisions that are medical or financial? And it gives you the ability to do that if somebody is deemed not able to make those decisions for themselves. Most obviously is like if someone's in a coma, but even if somebody is going into dementia, a doctor can help the family or you or whoever understand at what point do they need to sign power of attorney over to their children. Usually it's done before they get to that point, and then it's triggered by some kind of medical diagnosis or something. An advanced care directive is a really helpful one, though. And I'll tell you this because it's specifically relevant to those of you who will work with people with bipolar, schizophrenia, borderline personality disorders, some of these things where they'll be in situations where they could be deemed incompetent, like a manic episode, like a depressive episode where they're suicidal. Well, those are good examples. An advanced care directive basically says, here's a document that says, if I have to go to this place and I'm not in a state to take care of myself or in the right state of mind, here's what I could really use. So an example would be, I don't respond well to this one medication, and I've used this one in the past, but it might not be in these medical records because I just moved this community or whatever reason. So please use this medication, and then you can give it to the client or give it, have them sign a release of information to send over to the local inpatient unit, which you're pretty certain they're going to attend at some point. Or if you are facilitating getting them there, you can send them with this care directive and say, here's what the client sort of how they legally want to be treated. Now, there are limits to what that means, but it can be really helpful when a person is in a right state of mind to have an advanced care directive to guide other people to helping them the way they need to. So we can talk about that more if you want to. And then end of life circumstances. Wisconsin has no specific guidance or laws. Other states do. So if you're ever in that situation where a person is, they have a diagnosis, they're at end stage of life, and they're wondering about, is suicide's not legal, right? And we typically don't like to see people in that situation. And then there are these other considerations sort of on the fringes of what is our ethical responsibility, when usually we say suicide's not a good thing for people. We want to keep people alive. And then there are people that are in physical and emotional pain at the very end stages of life, and they're just ready to be done. It's a different conversation. So some states have had that conversation, others haven't. We've already discussed a little bit of these, but these are just resources for you. Understanding exploitation of children, child welfare. If you need more information about kids, then these are some sites to go. Reporting abuse. We haven't looked into exactly how you report, but that's a good place to start, that third one. And then some things that can be helpful to document while you're in this process. Documenting who you're with, when the report was made, whether oral report must be followed by a written report. Again, that's kind of like, can I just call, say hands off? Do I need to write something and then I'm hands off, or is there going to be more coming along with this? What information is required in the report? Whether the past abuse must be reported, and whether specific categories only must be reported. parents, neighbors, that kind of thing. So like really you're just trying to capture what kind of information do I need to provide? And that's something that you'll just ask as you move along. Depending on who you're reporting to, they might have different questions. Of course, this is where we have to know, here's the information I can say, and here's the information I don't want to say. But that's something I'm going to leave for you to navigate later on with the help of people that are closer to you in the scenario. Because it doesn't make a whole lot of sense to go through a billion scenarios right now. So there's a little quote by Marcus Aurelius. If you want to read it, pause it now. Otherwise, I'm going to stop the video and I will see you guys in class. Bye.